Today we will be speaking with Paul Petrini, Robbinsville varsity soccer captain. Paul suffered injuries primarily back-to-back, all sprains. The first sprain occurred after he was proposed a trade in fantasy football, and he severely overstretched ligaments in his middle finger after declining the proposal.
I
Here's
was
Paul.
offered Marshawn Lynch and Sam Bradford for Odell Beckham Jr., Cam Newton, and Todd Gurley. I was so offended that I went to type a subliminal message back, making it very obvious that I was in fact going to decline the trade, and as a result, I sprained my middle finger when I violently hit decline. And now I'm out 2 to 3 weeks.
That's terrible. Paul, you also suffered a sprained ankle along with a knee sprain. Can you explain that?
Well, an ankle sprain is when you overstretch a ligament or ligaments or snap them. This then leads to the unfortunate situation where there's inflammation in the ankle, so this means that I will not be able to walk on it for 2 weeks. A knee sprain is basically categorized by which ligament I have stretched or tore. For example, an ACL tear is a severe knee sprain that will require surgery.
Thank you, Paul, and good luck on your road to recovery.
Thank you. Factors contributing to sprains and strains include poor conditioning. Lack of conditioning can leave your muscles weak and more likely to sustain an injury. Fatigue. Tired muscles are less likely to provide good support for your joints. When you're tired, you're also more likely to succumb to forces that could stress a joint or overextend a muscle. Improper warm-up. Properly warming up before vigorous physical activity loosens your muscles and increases joint range of motion, making the muscles less tight and less prone to trauma and tears. Environmental conditions. Slippery or uneven surfaces can make you more prone to injury. Poor equipment. Ill-fitting or poorly maintained footwear or other sporting equipment can also contribute to the risk of sprain or strain. That's it. Anyone. The way it gets diagnosed is that a determination of the injury is made only after x-rays or physical exam is made by a specialist. And prognosis is determined by a complete recovery from a first-degree sprain, and first and second-degree sprains can be expected even without appropriate treatment. With second and third-degree sprains, even with appropriate treatment, some individuals will have a subsequent weakness and instability of the ankle, particularly on the lateral side. These individuals may be prone to a recurrent injury and may require an ankle brace for recreational activities and possibly even for normal walking if the injuries continue to recur.
Some symptoms that may occur with sprains are joint pain, joint swelling, joint bruising, joint pain while bearing weights, so lifting weights, and some treatments that could be used for this is the RICE technique, which is rest, ice, which is effective to restrict blood flow. The injury is swelled up, and this will decrease the size significantly. Compressed by wrapping an elastic ACE bandage or a sleeve lightly, not tightly, around the joint or limb. Special braces such as ankle can work better than elastic bandage for removing the swelling. Elevate above your heart level. And possible cures for this? Well, there is no possible cures. However, there are ways that sprains can be prevented, such as wearing a brace and getting wrapped by a professional using tapes.